I'm Abi Chapman. I'm think tank founder and director of Accessify. I'm also a disability researcher, advocate, and nationwide public speaker on disability lived experience. Today I'm going to speak a bit about policy design and sort of how we address the gaps of inequality in disability. But first, as we're responding, sometimes I find it really difficult to sort of respond from blank. So I have just put some cues. It's completely up to you. You can still go off your own imagination if you want. But maybe what disability means to you, what's your experience with accessibility barriers been, and what's your initial reaction to disability policy as I talk you through it. So I'm going to get straight into it and speak about the National Disability Strategy, which was the first piece of strategy ever created by the government, which was a commitment and a promise to improve disability living and lived experience. It was 8 points, essentially, that was a strategic path forward, which was to improve perceptions of disability, develop more accessible homes, improve the accessibility of public transport, improve employment gaps and education standards, create more consumer choice, widening access to arts, culture, sports, green environment, and ensuring public services are accessible. But did it work? The caveat is the policy is only 3 years old, and that's not a long time for policy, but we should be able to see some change, such as governmental advice or guidelines to put into place. I could speak all day on just one of them, so I'm going to go quite quickly over just 4. I appreciate I'm about to chuck a load of statistics at you. I'm going to upload my presentation to Padlet for those who need time to take it in. So attitudes, perceptions and behaviours. So in 2022, Scope released the Disability Attitudes Report and found that 1 in 3 state that they often have negative attitudes just in the last 12 months. That goes up to 1 in 2 under the age of 55, which correlates with sort of public perception of disability. The older we are, society is more accepting of disability, as it is a sort of automatic given right that as you get older you will become disabled. When it came to housing, before the strategy, the English Housing Survey found that 91% of houses were inaccessible for disabled people to just visit, let alone live in. 2 years later, last year, there was still 0 government guidance on housing, at the same time as having 400 wheelchair users living in unsuitable housing. To clarify, 93% of people with disability don't use a wheelchair, so the numbers are much bigger than this. And 20,000 wheelchair users were on the social housing list. Transport's a little bit more of a complicated one, because if we live in the UK, I think we can probably all accept that transport is inaccessible regardless of disability. But where accessible issues are for everyone, they are heightened for people with disability. So in 2023, the gap stood at 38%, and some quite scary statistics came out of research done by Motability. The one that sticks out most to me is that disabled people are 5 times more likely to be injured whilst travelling than non-disabled persons, and 30% have reduced their independence because of public transport accessibility. The final one that I looked at, which sort of had to be inevitable, was public service and the NHS. So in 2023, 76% of people were unsatisfied with the NHS, 87% with the social care service. We could analyse this, but I think it's quite easy to just say that it's not good enough. As NHS has become more inaccessible, waiting time for diagnostics, treatment going up, the main area that is becoming overwhelmed is A&E. So in 2010, 4-hour waits were introduced as standard. 10 years later, we are waiting usually more than 12 hours. We sort of see it in the first quarter 10 years ago, 150 patients waited over 12 hours. This year it was 150,000. Since 2011, there's also been a rise in admissions to A&E at the same time as 1% fall in general and acute beds, which sort of shows that there's a 32% gap in provision. And again, there's been no real plan to address NHS and social care accessibility and satisfaction. So I guess what does this all mean? Disability policy is often a lot of talk and very little action, regardless of political persuasion. I have been watching a lot of the general election. I've read every manifesto. Disability policy is not at the heart of any political party. But I want to take a step away from statistics and look at a case study. So person A was born very, very healthy, but by the time they were 15, they had a lot of medical issues. Sort of started at the age of 8. They experienced lower limb paralysis, ended up in a wheelchair. After lots and lots of tests, were told that it was psychological. Again, they'd have a simple break that would then later at 15 being told that the leg needed to be amputated. This person had privilege and their parents paid out for extensive rehab with success. They'd be diagnosed with Ehlers-Danlos syndrome, which is a connective tissue disorder. They'd be relatively okay until they were 21, where the individual became seriously unwell and their heart started to fail. Midway through that year, so it was 2017, the individual was told they'd have a cardiac arrest, and there was nothing they could do. In December, they would have that cardiac arrest. They'd miraculously survive and still haven't yet to get an answer of why that is. A few years later, their diagnosis list is very, very long. Under 6 different hospitals, 10 different specialities, 30 tablets a day. But despite their medical circumstances, their disability didn't cause a poor quality of life. The reason this was privilege. They had a support system, they had access to finance, education, employment, and they were okay, they could live with outside of their disability. Now I know that this person is relatively okay and this person has got a good life. This person A is me, and this is what drives me more than any of the statistics. It's my own lived experience with disability. And what I've learned is that we need to think differently about policy and differently about disability. We need to imagine a world where disability is not an automatic factor for poor quality of life. We need think tanks that are apolitical and able to think independently and think critically without bias, that are multidisciplinary, but most importantly involve people with lived experience, and that they don't just think but do. Which is why through my own work I have been working towards this. So 2 years ago I finished my Masters in Design for Social Innovation, and I actually launched the Accessibility Project, which was much more about community health. This year I've been working with a university in London to redevelop and launch Accessify, the think tank for accessible living. We have one aim, which is to work towards a world where disability is not an automatic factor for poor quality of life. So we sit outside of the medical box and the medical model of disability. We do it through 2 streams. We have projects and service. So our project is where we undertake research in accessibility, disability and community health. We will write the white paper, we will write the policy, but what we do is we take the innovations and the implementations suggested in that paper and we implement them straight into the community to make a positive impact. Our second stream is service. We do a lot of consultancy. We provide a lot of accessibility audits, which actually sit outside of our competition in terms of we don't just focus on the built environment, we focus on the social environment and help them create a well-rounded, accessible organisation. We work with schools as young as nursery all the way up to master's level training about how to enable an accessible society. I'm not going to go through all of this, but we are very, very well connected. Especially we are now based in Surrey with plans to expand to London and Sussex by 2025. But we believe in a holistic approach of all working together, which means we do all sit in meetings with the council, with the NHS, to the religious houses and the third sector, and actually just individuals who are interested. But we can't do it alone, and we need to do it together. So part of this is also asking for you guys to get involved if you want to. And there are 4 different ways to do this. You can join our management board, volunteer for projects, become a researcher, or join our community. The last one is quite simple. It's just sort of signing up to our community base. It is free at current. We are developing a membership programme where you will have to pay from autumn 2024, but this will get you exclusive access to our research, seminars, conferences and beyond. I'll put up a QR code at the end which will take you to a form which will tell you a little bit more about those roles as an expression of interest, or you can just email us or contact us on Instagram. Like I said, I know I've just chucked a load of information at you, so I will share this on Padlet soon. Thank you. So,
Makes a great picture.
I look great. So.